Now coming to the tabular data, there are so many epidemiological survey data is available, but this epidemiological survey data, you can just search this data. There are some National Health, Family and Health Care Society. They have published some data, but this data not like that for the district level or the state level. They have done some sample study and collected that informations by sampling of this data and for some particular geographical areas. So you can search this data and you will get some informations in this regard. Some hospital records that you need to do some analysis in respect to, there is a one tools are available. For example, let's say this is my study area. Okay, so I would like to collect the health related informations. So this is the quick WSM. There's another option, another plugin is available, which is called the quick WSM. Okay, you have to install that plugin, quick WSM. Okay, this one, quick WSM. So you have to install that plugin. Once you install, you will get this kind of icon. Once you click on that icon, you will get this window. On here, there is a one queries is available. Quick queries available. Here, let's say I am choosing the health data, for example. I don't know that health data is available or not, but health. Okay. So I'm choosing that health data, and study I am choosing the layer extent. This study area I'm choosing here. Okay. And or you can choose your canvas area as well. Okay. And then you can run the queries. So if any health related information is available, we'll be able to get the data from these tools. And these tools are actually providing that informations from your OpenStreetMap. So you can see the whatever the hospitals are available within this particular area of interest, it is there. We'll be able to get the data. So if you go to the attribute table, you can see the hospital, pharmacy. Okay, you are getting it here from here. There are the name, you will get it from here. So now what I'll do, I can save it the data, because again it's a temporary data. So I will save that hospital data. Now my hospital data in the GIS file format, I can classify it based on the type of the data. So it's a amenity. I'm classifying it. So see, so these are my ATM. ATM is not required. Clinic is required. Dentist is required. Doctor's locations required. Hospital, pharmacy. Okay, veterinary. Okay, these are the my informations that I got it from here. So like that way you can use these tools for your different types of health infrastructure related informations collection. Okay, and you can also update that information from by as I told you, like you can use your QGIS quick map service. You can use the Google Earth map, because as we all are very much familiar, Google level data. And from here you can also validate your information. So let's say you can make an edit, okay, and you can add some points also. Okay. What is the source of QuickOSM? QuickOSM is your OpenStreetMap, Chetan, as I told. It is a OpenStreetMap data. And even some of the let's say, because wherever no data is available, but if the data is available, you can collect the data from the remote sensing department or the state department. Then it's very it's good. Or if you can do some survey also, if your study area is small, you can collect some more reliable informations, more detailed informations. But it's there are some limitations. You just get the locations and name. But if you need to understand more details about the data attribute, let's say doctors, how many doctors are there, or pharmacy, what type of medicines are available. Okay, and if you want to understand about your hospital beds, hospital emergency number, hospital, any other attribute informations, then you have to collect it and you can update the data into a GIS database and you can use this data for your analysis. So it's a Google data only, and some Google data having some more informations, might have some more informations. You can update that informations by this is the beauty of the GIS, as I told. Like we can always dynamically update all the informations. So now coming to that section, like spatial join and attribute join of the epidemiological data and geographies. Okay. So what does it mean? It means, let's say, as I told, like I have this data. This data, I got the hospital name or your some type of hospitals. Okay. So I need to do a spatial join or attribute join. Spatial join means the joining can be happen between the point to polygon or polygon to point layer or line to polygon layer or polygon to line layer. One polygon layer have few informations and one point layer having informations. But there need to be must a unique key should be there, because how we make a link is to make a linkage we need some key, we need some connectivity, right? So this connectivity will help us to create the different types of attribute informations into a single layer. Otherwise, let's say you have a 1 lakh records, 10,000 records. Is it possible to do manually? Sometimes it's difficult. It is possible, but since it's a lengthy process, time consuming process, so many difficulties, challenges are there. But the spatial joining